Hello everyone. Today on this lecture we discuss about primary health care. So the primary health care meaning is it is the basic health care that will be provided at the first level. So we know that the three level of health service: primary level, secondary level, tertiary level. So the minimum basic health services that should be provided at the primary level is called primary health service. So this concept was being taken from the health for all concept by the WHO. In the year 1977, the WHO World Health Organization gave a slogan of health for all 2080. So health for all 2000, because that time the WHO find that the health services was not satisfactory, and there is an inequalities in the health services, the inequality in the health services of the people in the developing country and the developed country. Okay, so those who are inequalities means the urban, who are living in the urban area, who are in the rural area. The urban area, there the private organizations are there and the district hospitals are there, but those who are in the rural area or in the village area, so there is not there the health services is very deteriorate conditions. So the WHO give a slogan that help for all, and that could be the help for all that could be reached by 2000, attainment at the year of 2080. So the total slogan is help for all 2080, and help for all means we permit a healthcare that leads to a individual to socially and economically productive life. So we will provide a health services that leads to an individual socially and economically productive life. So that is called the health for all. And how this health for all will be achieved? So the help to reach this help for all, so we have to go a strategy, or we have to go a way that is called primary health care. So in the year of 1978, WHO, World Health Organization, and UNICEF, United Nations International Child Emergency Fund, conducted a conference at Alma Ata city of Kazakhstan. Okay, and in that conference, there are near about 137 countries are being participate, and 67 international organizations are there, and India also be there, one of the member of that conference also. And they acceptance this Alma Ata conference is also known as the acceptance of WHO concept. So what WHO given the concept, that's the health for all by 2080. So they accept this same concept, and how this reach to the health for all, the key way or the roadmap is the primary health care. So the primary health care is the key to achieve health for all by 2080. So the term primary health care is being defined by the Alma Ata conference. What is that? It is the essential healthcare. So it is one of the essential healthcare, or we will say the basic healthcare, made universally accessible. So all through the world or universe, they will accept this concept. This health service will be accessible to the made universally accessible to the individual. Accessible means reach. So it is called reach. The health service will be reach anyone in the world. It will be reach to the individual and acceptable to them. It will be, and it is acceptable, or they will agree to take this service. They will acceptable to them through their full participation, and at a cost the community and country can afford. So, and the cost, the how much of this health service, how much price of this health service, or you say what is the cost of the health service? The health service should be affordable prices, so everyone can. It's not enough money, so every can afford that health services. Okay, so four important points are there. First one is that it is essential healthcare, so it is it's clear. Second, made universally accessible means it can reach anywhere in the world, so it can universally accessible to individual and acceptable to them through their full participation. They need some participations, or that is called acceptable to them, or they agree by their full participation at a cost the community and country can afford. And this health services will be that much of is not so costly, that is affordable. It's a cost, is the cost is affordable by all the people. The cost the country and the community can afford, the community and the country, they can afford that health service. So this is called the primary health care. It's declared by the Alma Ata conference. Okay, and it has the 8 elements are there. So it's very easy to understand, because elements it will be start with E, and the number 8 EIGST, that also be started with E. So we will see what are the elements. So first one, that is the MCH care, including family planning services, because those who are vulnerable, that is the mother, the mother bearing during time of pregnancy, and also the children. So the maternal and child health care services, including family planning services. So that is the first element of the primary health care. Second, education concerning health problem and their control. So whatever the health problem, to educate the people. First one, the education. If you provide the education, then people can take the preventable by their self to control the problem. So first you have to aware or educate them. So the education concerning health problem and how to control them. Second, proper nutrition and food supply. So nutrition is a very important thing, because if you provide a good nutrition or a proper nutrition, then we will be number of problem like malnutrition, kwashiorkor, marasma, that is found in the under 5 children, or the women having the anemic conditions. So that can be preventable by this proper nutrition, by the taking of proper nutrition and food supply. Fourth one, promotion of safe water and the basic time. So that time the concept of sanitation, or you say the use of toilets was people are not concerned about that. So promotion of safe water, how to drink the safe water, and the basic sanitation, that is the one of the important element in the primary health care. Fifth one, immunization against the infectious and the vaccine preventable disease. So those who disease will be prevented by taking of vaccine, and those infections that can be treated by immunizations. So that can be that also be one of the element in the primary health care. Next to the sixth one, the control of locally endemic disease. Endemic matlab within the community or within the population. So you see sometimes in a particular area, in the month of July, August, we find the malaria cases, 10 or 5 malaria cases, and also in the next year also will the same population also be affected, same area being affected with the malaria cases. So that is within the population or within that particular region, that is called endemic diseases. So locally endemic diseases like malaria, filaria, diarrhea, that can be that could be controlled by the people. Okay, so this is also be one of the element in the primary health care. Next, treatment of common disease like the fever or headache. So these are the common disease, common problems, and also the common diseases that can be treatment will be provided by through primary health care. Next, provision of essential drugs. So all the health centers that can provide the essential drugs, that is ORS, or you say the folic acid tablets, and also the immunizations the government had given freely immunizations. So these are the essential drugs that can be provided to the people by through this primary health care. Primary health care. So it is also the one of the element, the 8 element in the primary health care. So this primary health care concept was based on the four principle, or the what you say four pillar. The first one is the equitable distributions. So health service will be equitably distributed, means those who are vulnerable kids like children, mother, so they need more care. Okay, we have give them more provide them attention and provide them health service as compared to the healthy one. So this is called the equitable distribution. Okay, so those who are needy or those who are vulnerable group, they give the health services reach to them, and they given the more focused health services should be provided to them. So that is called the equitable distributions. That means those who are needy and vulnerable, their needs, they will be given the more health services as compared to the other one. So by this way they will become in the same level. That is called equitable distribution. Okay. And the community participation, so all the health, this primary health services can be possible by the participation of the community. So if you see the local in that local sarpanch of that village, or you take the volunteers from the village, or you the postmen or the teachers, those who are working in the same village, or you say Anganwadi worker, Asha Karmachari, and the child birth attendant. So we will select the people of that particular area or that belongs to that community. So their involvement, or we will say their participations will be there, so that primary health care will be reach to the people. Okay, next one, that is a multi-sectoral approach. So we cannot be done, the health services cannot by the single effort of the healthcare delivery system. It needs the other sector also, like agriculture, animal husbandry, PWD, and sanitation department. So all should be, if they work if all the sector jointly given effort to a particular problem, so the primary healthcare services can be satisfactorily worked. So that is called the multi-sectoral approach. So we will take by the help of, or the intersectoral approach also, we can take by the joint effort of the all the department, like education, water and sanitation department, or you say the animal husbandry department, and the public PW department, all should be work together. So by their joint effort, the primary healthcare services will be rich. Next one, the appropriate technology. So the health services should be scientifically based. So whatever the health services we are providing, because we are saying that this is the primary and the first level of health services that will be provided, and that will be affordable prices already told. So these services should be scientifically proven. Okay, suppose we are taking a patient, we find a patient of diarrhea, then we are advise them to take oral solutions. So first we have to boil the water, then make it cool, 1 liter of water, then mix the sachet and drink. Allow the patient to drink frequently. So that is the scientifically proven that if a person is suffered with diarrhea, so dehydration may be occur, and due to rehydrate this one, so we can advise the oral solutions, ORS. And what is the cost of the oral solution? Is not so high. So that is called the scientifically proved, and also with affordable prices. So that is called the appropriate technology. Okay, if you see in the Anganwadi center, that is the Sakir scales are there to measure the malnutrition or the severe malnutrition cases. So there is a medium circumference by the measuring the depth of the medium circumference of the children or the pregnant mother, so we can find out the malnutrition or not, or obesity, or is a severe condition, or in a moderate condition of malnutrition. So that can be, so that is not so that is technically proven or it is scientifically proven, but it is not too cost, enough cost. So that is called the appropriate technology would be involved. So by this four principle, or you say the four pillar with the health services will be rich. And elements we already discussed, there are 8 elements, and it's giving first 3 elements, it's given to the vulnerable, that is the mother and children, because mother first, maternal and child health services, second, education of the health problem, next, proper nutrition, child needs proper nutrition, next, promotion of safe water and drinking, safe water and the basic sanitation is the basic thing. Next, the immunization against the disease, those infectious disease that can be treated by the immunization, and endemic disease that can be controlled by the people local government, and a common disease that can be treatment will be available, and provision of essential drugs that will be available, equipped sufficient basic medicines or the essential drugs that will be available in the health center. So this is called the elements of primary health care. And the primary we discussed the definition were very simple. It is the essential health care, first one. Second, made universally acceptable to the individual and acceptable to them through their full participation. at a cost the country and community and country can afford. So these are the basic points that is called accessible, acceptable and affordable. So I hope you understand the primary healthcare. Thank you for watching. Please keep on subscribing.